Good afternoon. I'm Professor Gene Morse. I'm speaking to you from the University of Buffalo in Buffalo, New York. And I'm very excited to be a part of the meeting today about national innovation systems for competitive industries, and in particular during this time period to discuss international experiences. What I'd like to do is run through briefly what we've been doing together with the University of Zimbabwe for about 15 years, and discuss how this can be used as a model for building the Zimbabwe pharmaceutical industry. Interestingly, we first got together with the University of Zimbabwe to address many concerns that came up during the HIV epidemic. And one of the initial foundational approaches to this was forming what we call the International Pharmacotherapy Education and Research Initiative, IPERI. And this was our organization that allowed us to begin to work together. And the goals of IPERI are listed here. And what you can see is that we started out with establishing a collaborative research and education center. Our goal was to build capacity, train new faculty, build new laboratories, and equip those laboratories with state-of-the-art technology resources. We also hope to have technology transfer so that new ideas from other places could be transferred and implemented in Zimbabwe. We fostered translational pharmacology research to enhance healthcare and economic development in Zimbabwe. And a lot of these different programs have led to the Center of Excellence at the University of Zimbabwe that we're discussing today. This just shows you some of the distance we were trying to overcome from Buffalo, which is shown here on the left, in upstate New York, close to the border with Canada, and Zimbabwe, and its location here as a hub for many other southern African countries. And what we were trying to do was build a bridge that would allow technology transfer and capacity building to occur. At the same time that we were developing this initiative, there were many advances in biomedical and healthcare informatics. So information technology and new approaches to using those applications really became a key part of what we envisioned as rapid development of a drug development program. Shown here, you can see that in the middle, healthcare informatics, primarily things like electronic medical records, and biomedical informatics, high-performance computing, storing data in a cloud, personalized smart card technologies. Many of these different applications ultimately came together and are now part of our program as we envision a drug development center in Zimbabwe. The other thing that we realized through this entire partnership building effort was that we would be more successful if we worked with existing organizations. Shown here in the upper left are global collaborations through research networks. In the lower left are global collaborations with industry. Upper right corner are resource-limited countries that had some existing pharmacology resources, and lower right were resource-limited countries that were really interested in building capacity. So it's really a matter of developing these linkages and bringing people together with a common goal. We were able to eventually receive some funding from the Fogarty International Center at the National Institutes of Health in the U.S., and it led to this HIV research training program. Now, the goals are summarized here. I won't go into detail in all of them, but just quickly you could see that our mission was to enhance antiretroviral access for HIV-infected patients, do research that would allow the optimization of treatments, but at the same time we wanted to implement and support a long-term plan for research training at the University of Zimbabwe, as it would ultimately translate into a research and development center. We also had long-term planning that would include pre-doctoral, doctoral, and postdoctoral students, eventually leading to a larger capacity to do research, and at the same time utilize many new web-based training programs that were being developed and implemented to accelerate the rate of capacity building and technology transfer. And all of these things have led to our ability to establish the University of Zimbabwe Center of Excellence, Clinical Pharmacology and Pharmaceutical Sciences. So over the course of about 16 years, we've built this virtual bridge. Individuals have gone back and forth across the bridge. These are just some diagrams of the trainees in laboratories showing data from their research and many of the cultural exchanges that we've had with visitors, both coming to the United States as well as our group in Buffalo visiting in Zimbabwe. IPERI also has had a big impact on our programs here at the University of Buffalo, and over the last 2 years we've implemented the Center for Integrated Global Biomedical Sciences. This center, the architecture of which is shown here, really brings together all of the things that we've had to put together to develop the programs in Zim, really including preclinical, translational, and clinical research associated with drug development, but also then integrating information technology, data analytics, commercialization, and regulatory compliance, and many of these things that really normally are all separate programs. We've now brought them together under this one umbrella to facilitate technology transfer and drug development. The center's goals are summarized here, really bringing together many of the programs that are already established or are being implemented at the University at Buffalo, as well as across the other SUNY academic health centers, which together are referred to as the SUNY Global Health Institute, and develop a sustainable business model for how the center can work with global health and global partners to sustain the types of research that we do here in the University at Buffalo, but also meet the needs of resource-limited countries as they seek to build capacity. This diagram illustrates the SUNY Global Health Institute and just identifies the different campuses around New York State. And each of these campuses has a technology incubator, and each of these campuses also have different global partners. So by taking this approach, what we've tried to do is develop a portal into the SUNY network of academic health centers that would facilitate and rapidly scale up programs in our partner countries, while also including the concept of public-private partnerships that can be nurtured within the technology incubators. And all of this kind of brings us to the meeting that you're having today about building the Zimbabwe pharmaceutical industry infrastructure. We hope that the Center of Excellence that we've been able to create will create a hub of activity, and these bullets just summarize some of the things that we think will go on. We hope to utilize the experiences we've gained over many years. We hope to seek funders to help us implement an instrumentation core to bring cutting-edge technology to the University of Zimbabwe. We hope to promote team science, bringing together scientists and entrepreneurs, including those in the fields of nanotechnology and STEM learning. We hope to translate this whole activity into workforce development so that as we seek to grow an industry in Zimbabwe, we're also simultaneously training those who will work in that industry. Some of this will occur in these public-private incubators where innovation and technology transfer can be occurring. And we have plans to expand our initial HIV research to be integrated into our vision for a Zimbabwe Cancer and Virology Research Institute that will discover drugs, new diagnostics, and new vaccines. All of this will be facilitated through a national program leading to local pharmaceutical development and enhanced regional economic development through business expansion. And the national network will be a linkage among the universities in Zimbabwe. So in summary, some of these key bullets illustrate what I think we're trying to accomplish at today's meeting. We're trying to envision the pharmaceutical manufacturing infrastructure, what that will require in terms of instrumentation, like new mass spectrometry instruments. In the nanotechnology area, there are particle sizing instruments, the instrumentation required for identifying and extracting new medicines from traditional and complementary medicine, and including quality systems management in all of these as they grow so that the data that are collected will meet regulatory approval. We also envision the integration of drone technology with information technology so that this initiative will link urban and rural regions, and that the data that will be sent from rural regions to urban centers will really be housed in state-of-the-art, high-performance computing centers. All of this will require continued international collaboration so that we continue to build human resources, nurture public-private innovation through incubators, and hopefully establish some linkage between the SUNY system and possibly having a satellite campus in Zimbabwe. We also envision the university network for the development of medicines and therapeutics to be a driving factor, bringing together many of the academic and entrepreneurial programs across the universities in Zimbabwe, and facilitating communication through a virtual hall conference center network that will then also be a linkage as a global hub. So I've tried to give you a little bit of background over the last 15 years that we've been working together and where we might be heading. I hope these are helpful for stimulating additional discussion throughout the conference today, and I will try to be on through a separate live telephone connection. So in closing, I would just say, Tatenda.